Hello everyone. Today we will be studying about pathogenicity and antibiotic susceptibility of Neisseria gonorrhea. So to begin with, we have to know few characters of Neisseria gonorrhea which are important. One is that it causes sexually transmitted infections. That means it causes venereal disease. Other word for sexually transmitted infections is it causes venereal disease, and it can be repeated in the same host. Then it develop multiple mechanisms to cope up with the innate and adaptive immunity of host. So it can fool the both the immunity, innate and adaptive immunity both. You want to know about the mechanism of that, of this, how it's fooling, what is present in this bacterium which is helping it in invading immunity. Then you can go to my lecture on virulence factors of Neisseria gonorrhea, where it will be explained how it is fooling the immunity. It can also block antibodies and can perform molecular mimicry and inhibit induction of apoptosis also. So how, what is present in it, how it is doing it, that you can learn from my video on virulence factors. Here we will be talking about pathogenicity. So what pathogenicity it is inducing? Its infection begins with the addition of the bacterium, that is gonorrhoeae, which is common name of Neisseria gonorrhea. And this addition occurs on the mucosal surfaces, most commonly urethra, and this adhesion is made firm and strong with the presence of pili. So this pili helps in adhesion, and this adhesion is so firm that even micturition, that is passing of urine, also do not flushes this bacterium out of the urethra. So this is because of the adhesion which happens due to presence of pili. And once it reaches to the tissues, it goes into intercellular spaces and reach the subepithelial connective tissue. And this happens approximately after the third day of infection. Incubation period of this bacterium ranges from 2 to 8 days. Symptoms can appear within 2 to 5 days of infection in case of males, but in females it may take long, over 30 days. Here, a point is to be remembered that Neisseria gonorrhea can be a common cell of female genital system. So, if it's present in the vagina, it can be a common cell. It becomes opportunistic many a times. When the infection is there, that means at that time it is opportunistic. Otherwise, Neisseria gonorrhea can be isolated as a common cell. Symptoms of this is painful urination, bloody or yellow vaginal secretions, and if they are left untreated, they can develop into pelvic inflammatory diseases. Of course, this happens in case of females. In males, penile discharge is which leads to swollen and painful testicles. So it's a condition in which epididymitis is noticed. Then it can this Neisseria gonorrhea or gonococcus can cause non-venereal infection also, like gonococcal conjunctivitis, or you can call it gonococcal ophthalmia, neonatal ophthalmia. And what happens in this case, how it happens, that is, infection is observed in newborn babies, that is, infection of conjunctiva is observed. And how the newborn baby has got this infection, it is while it was passing through the birth canal of a mother who was having this infection of gonococci. So while passing through the birth canal, a child get infected in the eyes, and this is the only non-venereal infection of gonococcus. It's an important point to be remembered. Few more characters. Let's talk about gonorrhea. That is, it's a delicate organism. Why I'm calling it delicate? Because it is obligate parasite. It's not going to survive outside the host. So it's readily killed by heat, drying, antiseptics. Strict parasite that I have already discussed. It dies in 1 to 2 hours if outside the body, and it has a tendency to develop resistance to all clinically useful antibiotics. That means while inside the host, it has a tendency. Otherwise, outside the host, it's very delicate. But when inside the host, it has a tendency to develop resistance. Why? Because it can change its shape. So it has it can cause phase variations and its outer membrane keeps on changing. You want to know more about this? You can again go back to my video on virulence factor of Neisseria gonorrhoeae. There you will be able to understand this variation better. Coming to the history of evolution of antibiotics. Now, this bacterium is the one which is always changing its outer, because of the outer membranes, variations and mutations are occurring, and that is why it is becoming resistant against many bacteria, many antibiotics. So first antibiotic, protargol in 1890 was the one which was effective against it. Then sulfonamides in 1930s were used, which was more effective against it. Then it became resistant, and penicillin was the antibiotic which was working against it. This was until 1940s. Then in 1950s, we moved on to tetracyclines because Neisseria gonorrhoeae became resistant. So it was treated by tetracyclines. Then cephalosporins are used since 1980s. That means tetracyclines also became resistant. So we moved on to cephalosporins. So cifratriaxone and cefixime is being used since 1980s too. This was used since 1980s to till 2000. No resistance was as such noted, but from 2000 it has been seen again these resistance against these two antibiotics, that is cifratriaxone and cefixime, has been noted. So a combination therapy was given then, and this combination therapy was injectable cefratriaxone plus an oral antibiotic like azithromycin. But it is noticed that still uh, it is this bacteria is becoming resistant and is still the cause of sexually transmitted infections, second largest cause of sexually transmitted infections. And this has continued to show developing antibiotic resistance, XDR-GC, that means extensively drug resistant gonorrhea, is being reported, which is a thing of concern. So today I was focusing on the pathogenicity and antibiotic resistance of Neisseria gonorrhoeae. I hope you have enjoyed, and please do like and subscribe if you like the video made by me. Thank you so much.